Well, welcome everybody. We'll get our annual general meeting and annual members meeting underway here at Nottinghamshire Healthcare NHS Foundation Trust. So, hello everybody, I'm Paul Devlin, I am the Trust Chair. I've got the pleasure of steering you through this meeting today. And in the room with me, I have our lead governor, Jim Aleander, who will be speaking a little later. One of our governors, Dr. Jazz Lidder, is in the room with us. Other governors I know are joining us online virtually, and we're also supported in the room by Lucy Mills, our Governor Support Officer. So I'm delighted to welcome you to this year's annual general meeting, annual members meeting. I'll refer to it as the AGM from now on, just so it'll take a little less time. And today's meeting is somewhat scaled back from our original plans, in part because elements of our preparation had to be paused during the period of mourning for Her Majesty Queen Elizabeth II's death. However, alongside today's event, we also have an exciting showcase event planned for the 7th of November, where we will be sharing much more on the fantastic work of our services, including enabling staff to showcase some of what they do. And we will be sharing further details a little nearer the time. I hope you're able to join us for that event, and our intent is to have that as a big event in person as well. So our meeting today will focus specifically on the financial year 2021-22, so up until 31st of March 2022. And as that's several months ago, there will have been other changes since that time, but we won't be referencing those. We'll be focusing in on that particular year. All the documents that we talk about during the meeting are already available on our website. And there's a slide, I think, to show where to find them, and if not, it will be there at the end of this event. A recording of today's meeting with subtitles will be made available on our website in a few days' time. If you are using MS Teams rather than a web browser, you could try adding captions and subtitles through your settings button, although as with live news channels, the subtitles might not be wholly accurate, which could add an interesting dynamic to the meeting today. So, just a few words of context from me. This is my third AGM at Nottinghamshire Healthcare, as I joined the Trust in January 2020. And during my time here, I've met many staff and volunteers, and indeed met many of the people who use our services and their families and carers. And I'm always impressed with the services that are provided through this trust. The commitment of our staff and volunteers to those who need our services makes me truly proud, and particularly so on the back of the continued challenges from the pandemic and its aftermath, which was so live during the period that we are reflecting on. So the meeting today has some formal things that we need to do. So key things: to receive and agree the minutes of last year's annual general meeting, to receive the annual report and accounts for 2021-22, and to celebrate some of the achievements from around the Trust from that 2021-2022 year. So our first task is to consider the minutes of our last AGM and whether they are a true and accurate record of this meeting. And as we are unable to take comments from the public in real time again this year, we've agreed that anyone wishing to comment on the accuracy of the minutes can email our Deputy Director of Corporate Services, Rebecca Allen, with comments. And if required, the board will review those comments and make sure they're given formal consideration. So with that caveat, could I invite a proposer and a seconder to recommend receipt of the minutes, please? Do I have somebody to propose the minutes?
I'm happy to propose the minutes as a true record of last year's meeting.
Many thanks, Jim. And do I have somebody who's able to second that proposal, please?
I'm happy to second the minutes, Chair. Manjit Darby, Non-Exec Director.
Thank you for that, Manjit. And on the basis of that, we will take those minutes as a true and accurate record with the caveat that I explained there. So thank you very much. So next, I'd like to introduce our lead governor, Jim Aleander, to talk to you about some of the Council of Governors activity that has taken place over the year. And just before I invite you to speak, Jim, I'd like to acknowledge your personal contribution to the Trust throughout 2021-22. The role of lead governor at a time when so much of our face-to-face engagement and meeting had to be curtailed brought about some real challenges, including things like meeting with other governors and in visiting services. And throughout the year, you've worked incredibly hard to carry out your role, and you've sought to work alongside me and my board colleagues and helped ensure the Council of Governors have held non-executive directors to account. And I have personally benefited, Jim, from your wisdom, perspective and thoughtful challenge. I just wanted to place that on record at this year's annual general meeting. So I'll now hand across to you. Thank you.
Well, thank you very much for those kind words, Paul. I'm delighted to be able to present an overview of the work of the Council of Governors for the year 2021 to 22. I'm Jim Aleander, as you've heard, lead governor. I've only been a public governor since 2019, and I represent the county area in my role as public governor. The year in question was an extraordinary one again for the Council of Governors, for the Trust, and of course for the NHS more widely and the nation through the pandemic. In my position as lead governor, I've worked closely with the Trust Chair, Paul, as you've heard, to ensure that our own contribution as governors is made and to review and plan activities. I must thank equally Paul, the non-executive directors, the senior management and the administrative team who support the Trust directors and governors for the way they've enabled the Council to carry out its work in the year in question, given the difficulties that we faced. I'm pleased to report, however, and put on record for this meeting that the Council of Governors has fulfilled its statutory duties for the year. Governor activities in the Trust increased significantly from what we'd seen in 2020. And although still mainly virtual in form, we engaged a significant number of governors engaged in their duties very effectively, in my view. We were pleased to be able to hold our first in-person Council of Governors meeting since February 2020, which took place in October 2021. I should say, with appropriate social distancing and with PPE. Alongside the formal statutory Council of Governor meetings, which are held quarterly, there were two informal joint meetings of the board in July and November 2021, as well as a question and answer session in August 2021. During 21-22, governors continued to hold the Trust to account on its priorities through our formal meetings, supported by our steering group and by the Nominations and Remuneration Committee. Governors had the opportunity as well to join focus sessions with the CQC, the Care Quality Commission, as part of the well-led review and support the Great Place to Work programme, along with the activities on bringing our values and behaviours together. Governors also had the opportunity to comment on the development of the new Trust strategy in an engagement session which was held in autumn 2021. I should add to that, by the way, we also had the opportunity for follow-up engagement in the final development of the strategy. On the wider issue of strategy, a working group was set up to look at refreshing the Trust's membership strategy, and I believe a significant number of members have joined our meeting today. Work is ongoing at looking at our membership demographics and how representative we are of the population we serve. The aim of the working group is to influence a new strategy for membership, which is inclusive and which is also reflective of our new NHS system. Governors were also involved in reviewing the quality report for the Trust and providing commentary as appropriate on the quality report ahead of the report being finalised. We also received the annual audit report, as we are required to, from our external auditors Mazars, and were able to question the auditors on their findings. An ongoing log of all governor questions and issues or concerns has been maintained, with actions and outcomes recorded and fed back to the Council of Governors at formal meetings, where impact and required actions can be demonstrated. We were keen to reinstate governor visits to services in 2021 where appropriate. Whilst this wasn't always generally possible in person, there were several opportunities for governors to attend virtual visits to non-clinical services with non-executive directors from about the middle of 2021. A total of 9 such meetings took place with teams like the PALS and complaints team, the facilities, patient safety teams, learning and organisational development, and the involvement, experience and volunteering team. Governors who have been involved commented on how valuable those meetings were. In addition to these virtual visits, a face-to-face visit to Carlisle Ward at Rampton Hospital took place on the 25th of November, and 4 governors attended. The visit included meeting patients and staff, viewing the facilities and hearing a patient's story. I attended that visit and I found the patient's story quite profound. We also demonstrated the continued development of our Council of Governors and held online development sessions during 2021-22 on freedom to speak up, the board assurance framework, trust strategy development and offender healthcare. As well as our internal development programme, governors are regularly invited to take part in the offer of development courses nationally hosted by NHS providers. In November 2021, an election process commenced to elect 15 governors to vacancies across the public and healthcare constituencies, the public and staff constituencies. Governors who were elected for a 3-year term in 2019 reached the end of their office, their term of office, on the 28th of February 2022. This election included 2 additional vacancies in the Nottinghamshire County constituency, where 1 governor had taken up a position of employment with the Trust and 1 governor had decided to stand down. All but 2 constituencies were contested and 10 of the 15 vacancies were filled, leaving 4 remaining vacancies in the Nottinghamshire County constituency and 1 vacancy in the Staff Allied Health Professionals constituency. An induction programme was held for new governors in March 2022, and that included internal trust induction and a session on core skills for governors hosted by NHS providers. Linked to the election, the Council of Governors has approved a reduction to the overall size of the Council from 37 to 27 members. The rationale for this is that the Trust has a large Council of Governors by national standards of such trusts at 37, but it is a much smaller number who are actively engaged and participating in governor meetings and duties. The Council has carried recurrent public vacancies where seats have been unfilled in elections or have been vacated. In the last governor election I just referred to, 5 vacancies were filled and a further 2 have since been created. No governor is being stood down as part of this process of change, and the role and duties of governor and the council remain the same. The reduced number will come into effect in autumn 2022, when terms of office come to an end and the next governor elections are held. Moving on, governor representatives were involved in the interview process for 4 new non-executive directors in December 2021. The recommendations were subsequently approved by the Council of Governors at their meeting in January 2022. 2 governors were involved in a stakeholder interview panel for the Executive Director of Partnerships and Strategy in January 2022. I would like to thank all the staff and non-executive directors who have given their time and have contributed to the meetings so that we could undertake our duties in an informed way and be assured about the Trust's performance. Finally, I thank my fellow governors for their commitment to their roles in another demanding year, in particular governors who were newly elected in 2021 and 2022. They have had only a partial opportunity to engage with the Trust in the ways that they would wish, and had limited scope to meet and network in person with their fellow governors. I also thank the public at large and our members for the huge support for the services provided by NHS Nottinghamshire Healthcare. As you know, we will shortly be welcoming a new Chief Executive Officer, but on behalf of the Council of Governors, I would like to thank John Bruin for his dedicated service and wish him a long and happy retirement. John has served not only the Trust, but the local health economy extremely well through very difficult times, and he will be much missed. The responsibilities of the Council and its activities for the year 2021 to 22 are laid out in full in the annual report. Now that concludes my report on behalf of the Council of Governors, and I am passing over to our Executive Director for Finance and Estates, Alison Wyld. Thank you.
Thank you very much. Good afternoon. My name is Alison Wyld and I'm the Trust Executive Director of Finance and Estates. And over the next few minutes, I'm going to take you through our finances for the 21-22 financial year. The key headlines for our finances are that the Trust has met all of its financial obligations throughout what has been another very challenging year. Our regulators, NHS England, monitor our finances, and for our finances in that year, we delivered a planned break-even position. And our accounts have been reviewed by our external auditors, Mazars, and they have given an unqualified opinion. There's a second aspect to the review of our accounts and processes, and that's the value for money opinion. This work was slightly delayed this year as we awaited the results of our CQC inspection. As these results are still awaited from the CQC, our external audit opinion has now been based on last year's value for money assessment, which I'm pleased to confirm did not identify any areas of significant weakness against the specified criteria. Therefore, our annual report and accounts were able to be laid before Parliament by the required deadline in September, meaning our accounts and annual report are now available for public review. Over the last year, our finances continued to be significantly affected by the pandemic. We were paid in a very different way to what we would normally expect, and we were given a nationally determined block, within which we managed our expenditure, and we did so in a very successful way and by delivering a planned break-even position. As part of the journey to financial balance, some pre-COVID requirements have begun to be reintroduced. For example, the submission to our regulators of financial plans and the required delivery of a financial improvement programme. There's also been continued significant number of COVID costs in this financial year, and these were included in that financial position. Things like PPE, personal protective equipment, and the additional staff that we needed from agency and from bank when we found we needed support as our staff isolated from COVID. So over the course of that last financial year, we received £650 million worth of income. Most of that income is for the direct provision of our services, and it comes mainly from NHS England for our regionalised, specialised and national services, and the vast majority of the rest of that service income comes from our local commissioners, and they are Nottingham and Nottinghamshire CCG, Clinical Commissioning Group, and also Bassett Law CCG for the services we provide there. However, we also receive other income seen in the pie chart for things like education, training and research. So the next slide takes us through what we spend this money on, and as I think you would expect, we spend the vast majority of our money, £411 million of it, on our staff and workforce to deliver our services. We also spend money on purchasing healthcare from other organisations like our voluntary sector partners elsewhere in our system. So the next slide, please. So a little bit more on what it has meant for us using COVID on our finances. So you can see our COVID expenditure was £9 million, and that was, as we already said, things like PPE and the costs we need to make sure our teams could work from home effectively during the pandemic. Together with system partners, we've also continued to provide the vaccination programme for Nottingham and Nottinghamshire, and our share of the costs for that as an organisation has been £3 million. Both of those items totaled £12 million and have been fully reimbursed to the organisation via additional income in this financial year. And whilst we have been managing through the pandemic, we've also managed to continue to invest in our capital programme, and that is for significant items of expenditure like estates and equipment that are designed to last a number of years and support the development of our services. For this, our spend totaled £27 million. I'll now take you through a little bit of detail of what we spent that money on. Most significantly, last year we spent £14 million on the continued alterations at a hospital in Mansfield that's known as Sherwood Oaks. And this is the continuation of our journey on eradicating dormitories and our mental health wards, which is a national priority. We also spent £10 million on the Trust's digital infrastructure, continuing improvements on our virtual private network, which is what our staff use to access working remotely, as well as our Wi-Fi network for Trust properties. The balance of that 27 million was spent on essential backlog maintenance, things like making sure our buildings are safe and secure and that we can deliver high quality services from them. Next slide, please. Finally, one last area of our regulation is that we are regulated on our finances by what is known as a use of resources score. That works on a sliding scale from 1 being what regulators are least worried about, up to 4 where organisations would be put in special measures and receive significant financial support. I'm pleased to say that in this financial year we have again reported a score of 2. And that's largely because of the additional agency spend in place because of supporting the need for extra staff during the pandemic. So that's the last of what I wanted to take you through on our finances over the last financial year, and I'm now going to hand you over to our Chief Executive. Thank you.
Thank you, Alison. That was really useful. My name is Newham. I'm Chief Executive. And thank you as always for everything really straightforward and simple. Just as many of us me find that really useful. So I'm really proud to be the Chief Executive of Nottinghamshire Healthcare, and until the new Chief Executive starts, if demerged, he will join us in December. I am honoured and proud to work alongside so many dedicated and talented staff and volunteers who care for our patients 365 days of the year. I'm going to spend a little time now talking to you about some of the challenges and the highlights of the past year. And I cannot do that without starting with a massive thank you to each and every member of our staff, our volunteers and our carers for their unwavering dedication and commitment over what has been yet another challenging year. Colleagues across the Trust came together to again go above and beyond in these unprecedented times, demonstrating passion and determination, innovating and adapting their working practices and services to ensure that our patients and service users continue to receive the very best care and treatment that we were able to offer. So throughout the ongoing pandemic, our staff colleagues and volunteers rose to the daily challenge of an ever-fluctuating COVID-19 picture. We've maintained close working partnerships with other organisations across the Nottingham and Nottinghamshire Integrated Care System, also known as an ICS. And we did that to ensure that we were able to continue to provide care. Working alongside colleagues from neighbouring organisations, we are proud of the local vaccination programme, which we led and also which enabled several thousand of people to receive their COVID-19 vaccinations. We've worked together as a trust and also as part of the Nottinghamshire system and wider, working as part of local, regional and national collaboratives. Impact, which is the specialist mental health provider collaborative that we lead on for secure services in the East Midlands, has now been in operation for about 2 years. And the guiding principles of Impact are to focus on co-production with service users and on improved experience and outcomes. We're also forging ahead with other partnerships, such as those with local hospital trusts, including Nottingham University, Sherwood Forest and Doncaster and Bassetlaw hospitals, which are focusing on transformation and efficiencies. We also have strong alliances working with social care, city and district councils, primary care and community and voluntary sector partners, looking collectively at issues such as prevention, improved access and health inequalities to help improve outcomes from a population-based perspective. So I couldn't update you without mentioning the CQC, and that is the Care Quality Commission. So in early 2019, the CQC inspected us and gave us a rating as a trust as requires improvement overall. We retained at that point ratings of good for effectiveness and good for caring as well. So whilst that rating was not what we would want and it was broadly expected, we accepted the overall opinion of the inspection team that we needed to improve across every domain. Since that time, we've continued to make improvements, and during the early part of 2022, the Trust underwent a further well-led inspection. At the time of writing, we are awaiting the outcomes of that inspection, but we are confident that the work undertaken since 2019 has resulted in continued improvements to patient care and the employment experience of our staff. We hope this will be reflected in improved ratings when we receive the CQC report. In the meantime, the CQC continues to carry out unannounced, focused inspections. One such inspection for which we have recently received the results relates to our forensic inpatient services. So back in 2021, February, the CQC rated those services as inadequate overall and issued us with a warning notice. At their most recent inspection in early 2022, the CQC reported that all concerns had either been addressed or were in progress. So I'm pleased to report that the overall rating for our forensic inpatient services has now improved from inadequate to good, which is fantastic news for the patients who use those services as well as our colleagues who work in them. Whilst feedback from regulators such as the CQC is important, we also welcome feedback from our staff colleagues, and we were therefore pleased that our results in the NHS staff survey continue to demonstrate improvement from a few years before. So our response rate has improved, 57% compared with 45% 2 years before, and higher than the average response rate for similar trusts. So for the first time, the survey was aligned to the themes of the NHS People Promise, alongside the two previous elements of staff engagement and morale. The Trust is above the national average in all of these areas, which is great to hear. And it was particularly pleasing to see that, again, colleagues would recommend the Trust as a place to work and as a place to receive treatment. Whilst these results are encouraging, we continue to explore the detail with colleagues to enable us to achieve even more improvements. We are absolutely committed to working with colleagues to create the right environment for our staff so that they can in turn give our patients the best care. During the year, we have continued to lead from the board on our equality, diversity and inclusion work. We have been particularly pleased to work with our equality staff networks on key programmes of work, including driving forward our anti-racist work and celebrating staff through events like the Black History Month and our LGBT History Month. We are pleased to report that although we have again faced a challenging year for all of the reasons stated above, we ended the year having met all of our financial targets. This is a testament to the work of colleagues across the Trust. So over the last 12 months, our teams have gone above and beyond. The commitment and dedication of all staff to making a difference in these challenging times is truly inspiring. We consider the Trust to be a reflective organisation which endeavours to use the learning from negative issues as improvement continues and opportunities for these. We're also proud of the people who work for us, and we continue to recognise and celebrate their achievements through local, regional and national awards. Pages 6 to 8 of our annual report highlights just some of our achievements, and we also have a celebrating success page to our website. In summary, the Trust and its staff and volunteers have yet again overcome challenges, and have continued to also experience a great many successes. We remain confident that the foundations we have created as an organisation continue to benefit our patients, their carers, and our staff and volunteers, and will do so for many years to come. I will end with a final slide which depicts some of the many awards and accreditations colleagues have achieved during the year. Thank you.
Thanks very much, Anne-Maria. And we now are able to move on to a short question and answer session. We advertised in advance that we sought questions from the public ahead of the meeting, and we've had 3 questions that I would like to bring to the annual general meeting. We asked for questions in advance. It gives us an opportunity to make sure that we can give considered answers and to really consider the question that has been asked. So the first one, Anne-Maria, I will pass to you to give me a response, please, if you can. The first question is from Benjamin and asks, will the Trust offer support to staff who feel they may have been injured by the COVID injections? Anne-Maria.
Oh, thank you very much. Yes, thank you, Paul. We've had this question posed to us throughout the last 18 months, and we've had similar questions to our board of directors and also to some of our other committees. So just to reassure, we absolutely will support anybody that has been injured, if at all, and we have a very, very good health and wellbeing support within the organisation that can be accessed, and the information for that is on our Connect pages, which is our intranet, which is available to all staff. And I would also just like to say that I know that there was a concern raised about not being able to work for the Trust if you hadn't been vaccinated. Now, at one point, the government did potentially say that that would be the case. Now, that did not happen, so we did not put that in place. So it did not arise that you had to be vaccinated in order to work for us. So I just want to apologise if anybody was distressed by that, or at any time that people felt that that was going to happen and they might have to leave the organisation. But I just want to say that we would never want to hear that staff weren't able to access. We have our Freedom to Speak Up Guardian, we have Freedom to Speak Up champions across the organisation as well, and line managers will take any queries from staff as well. So please don't be out there thinking that there's no access to support, because there absolutely is.
That's great, thanks, Anne-Maria. The second question is one that's a very current one, actually, and this was brought to us by Tony, which said, I see in the news that a critical incident has been announced across Nottingham and Nottinghamshire. What is being done to deal with the demand? So, Anne-Maria, again, if I could go to you to give us a response to that, understanding that it is absolutely very current as well.
So thank you for the question. I think it's a very pertinent question, considering we are currently in critical incident mode. So just to say that actually about 6 weeks ago, the whole system, so when I say system, that is Nottinghamshire, all the providers and the commissioners declared a critical incident at that point, and it lasted for exactly 6.5 days. This one was called, again, the middle of this week, so it's classed as a critical incident across the system again, so it's a similar thing that happened before. What that actually means is that the acute trusts, so when I say acute trusts, I mean Sherwood Hospitals and Nottingham University Hospitals, are unable to cope with the demand of patients coming through their emergency pathways. So that tends to be things like the accident and emergency, and through the with ambulances dropping off patients at accident and emergency. So the critical incident was called because there was more patients waiting than they actually had beds for. So what happens then is the system all gets together. We have regular meetings, 2 or 3 meetings a day, where we look at how we can relieve the system from that. So we look at whether or not we can expedite discharges, whether or not we can prevent patients going in the very first place. Now, how that affects us as an organisation, we have a very, very good input into that system. I have to name a couple of people. So we have our Executive Director of Community Health Services, Becky Sutton, and we have the Deputy Director of Community Health Services, Keely Sheldon. They attend those meetings, and they have put in some fantastic support to the system to enable those discharges to happen and to prevent patients going in the first place. So we're as part of that, we're part of the answer, part of the solution to that incident, and that's what's occurring at the moment.
Thanks very much, Anne-Maria, and I know that particularly thinking about the winter months ahead, it's going to be absolutely critical that we continue to play our collaborative part in the way that you've described there. So the third and final question that I want to refer to came from Norman, and the question relates to the United Nations Declaration on the Rights of Indigenous Peoples. And Norman asked, in what ways is the Trust meeting its obligations outlined in the articles of that treaty, and how is the NHS informing the Indigenous of their rights as part of the Trust's obligation? I found this an interesting question and was able to do some personal research as well as ask the question within the organisation. As a Trust, we have a comprehensive equality, diversity and inclusion policy which protects people in line with the duties of the Equality Act 2010, which ensures that no staff member, patient or anyone else who comes into contact with our services will be discriminated against or harassed, and that their rights are upheld in line with UK and all other applicable legislation. So within that would be any of the commitments that we, through the commitments our governments will have made to the United Nations declarations, will be things that apply to us. So as part of our commitment to celebrating diversity and inclusion, we welcome and encourage all staff, patients and service users from all of our diverse communities, including any of the Indigenous peoples that, Norman, you may have been referring to, and we really seek to help them express their unique cultural, national and social identities. So that draws to a conclusion the annual general meeting, annual members meeting, recognising the year 2021-2022. I'd like to thank colleagues who have been working behind the scenes to enable this to go ahead in this format. It still feels like we're learning how to do the best we can with these digital tools. And again, as I did last year, I very much hope that next year we will be able to have our annual general meeting and annual members meeting in person, directly coupled with the celebratory event that we will be holding a little later this year. So that becomes a part of the celebratory aspect of our annual general meeting. And I'd like to finish by reiterating my thanks to all of our staff and volunteers, and to you for attending. Thank you.